Good afternoon. I was delighted when Charles Looney asked me to come and talk a little bit about horse embryo transfer and embryo production. He said that most of you are bovine practitioners, and so I should talk, just explain the ways that horse is different from cattle. And I think a lot of them are really fascinating. So hopefully this will be interesting for people who don't work in the horse. First of all, one question I get a lot is, well, I thought horses couldn't do artificial insemination, couldn't do embryo transfer. But that's the thoroughbred, the racing thoroughbred. The jockey club requires that a stallion actually mount and breed a mare for the thoroughbred. But many, many other horses exist in the world besides thoroughbreds. And in the United States, I guess this is working too. In the United States, there are actually more quarter horses, more American quarter horses registered every year than all other breeds combined. So quarter horses, horses used for barrel racing don't even have to be registered, more quarter horses. And then horses used for events like dressage, such as dressage and show jumping, their breed registries will allow assisted reproduction, and in fact, you don't even have to be registered to compete. So actually, assisted reproduction is huge in the horse industry. We'll look at equine embryo transfer just a little bit. Equine embryo transfer is very common. It's probably the most common real assisted reproduction other than artificial insemination and shipping semen. But even so, Brad Stroud got together the last data on this that's really effective, and he registered that there were 25,000 embryo transfers done in horses versus more than 500,000 done in cattle. So even though we say that it's very popular, there's not really a huge market numbers-wise. One of the main things that really differs between equine embryo transfer and bovine embryo transfer is that superovulation is still not effective in the horse. There are some preparations of FSH, especially in equine FSH, that can get horses to superovulate, but in those terms, the average superovulation is 3 follicles. You could say, well, 3 follicles is 3 times as good as 1 follicle, which is what we're dealing with on a normal cycle. But unfortunately, the embryo recovery doesn't appear to increase linearly with the number of follicles. And what people think that's due to is the strange situation in the horse where all follicles ovulate here in the ovulation fossa. In fact, the oviduct is attached to the ovulation fossa because it knows where the oocytes are going to come out. So you could think, well, this is a corpus luteum here in this ovary. You could think the first follicle could ovulate normally, but then ovulation in the mare is a very bloody procedure. You get a corpus hemorrhagicum forming, and you could assume that there's blood in the ovulation fossa. And so when another follicle wanted to ovulate there, the oocyte perhaps doesn't get out. So along with that and the fact that even though research projects showed the FSH worked fairly well, but in practice, practitioners had a lot of troubles with it, means that most practitioners just go for the one naturally occurring ovulation to do embryo transfer with. So this is a sort of a one-at-a-time thing. The thing that makes it worthwhile commercially is that foals are worth so much money that if you have a good mare, it's worth it to have just one chance at 1 embryo per cycle on that mare. Mares are interesting also in that there's no really good way to predict when they're going to ovulate. They're in heat for a variable period of time, and they don't actually have a discrete LH surge. LH rises throughout the 5 to 7 days that the mares show estrus and actually peaks after ovulation. So if we want to know when exactly this mare ovulated, which we do to do the embryo recovery, we have to do it by looking at ultrasound, doing a transrectal ultrasound. We ultrasound daily when she's in heat after a certain follicle size. We know she's very unlikely to ovulate a follicle before about 30 millimeters. So starting at 25 millimeters, we'd probably ultrasound her every day. We'll breed basically on follicle size and follicle characteristics. So we're looking at that follicle. Does it look like a follicle that's going to ovulate? How big a follicle did this mare ovulate last cycle? And then we'll inseminate her. Our goal is to hopefully only have to inseminate her one time. Typically, in order to reach that goal so that we don't have to inseminate her multiple times, we'll give her HCG to stimulate ovulation. And we anticipate that on a follicle about 33 millimeters in diameter, that in quarter horses, most of them are going to ovulate. 85% of those horses will ovulate 36 hours around after HCG. So that way we can give HCG and then inseminate the mare and have great timing for our insemination. In the mare, this is something that I don't see pointed out often enough. In the mare, we call day 0 the day that we see the follicle has ovulated. So if somebody's comparing a bovine embryo at day 5 with a horse embryo at day 5, we're actually comparing apples to oranges because day 5 in the cow is from when she showed heat. So here, day of ovulation is day 0. The embryo stays in the oviduct for a little longer than it does in many other species. In this case, it stays in the oviduct for 5 days. And we could explain this sort of logically in that during estrus, the cervix of the mare opens wide open. You can, in a mare that's foaled, you could put your whole hand through the cervix into the uterus. So when the stallion ejaculates, he actually ejaculates directly into the uterus during natural mating. And so the uterus is bombarded with all sorts of debris and bacteria. So it has to clean itself out, and that's quite a job before the embryo comes in. So the embryo stays in the oviduct about 5 days and comes into the uterus on late day 5. At that point, when we can first get it from the uterus on day 6, it's a morula. It's about 200 microns in diameter, and it looks sort of like the morula of any other species. It moves around the uterus from the time it enters, so that if we want to collect it from the uterus, we have to flush the entire uterus with fluid in order to get the embryo, because we don't know where it will be. So that takes about a liter of fluid. Even though it comes into the uterus at day 6, we typically flush at day 7 or 8 because the recovery rate has been reported often to be lower on day 6. Now, because people have done studies looking at where is the embryo, we know it's in the uterus on day 6. So why the recovery rate is lower, to me, it's probably because the embryo is harder to find, or perhaps the embryo doesn't come out as easily. So typically we'll flush on day 7 or 8. The embryo grows very quickly. By day 9, it's got a large enough diameter that it's fragile and easily damaged during handling. So most people collect on day 7 or 8. And as I said, you must flush the entire uterus because we don't know where the embryo is going to be at any given time. Typically, people will flush the uterus with 1 liter and repeat that 3 times. But interestingly, there was a paper way back in the 70s when this first started that said if you flush a 4th time, you'll get 10% more embryos. So I don't know why we're stuck with 3. This is a colleague of mine in Argentina. He's doing the flush all by himself. He's got a liter bag of fluid up here, just a Y set up with tubing, and then down through the embryo filter here, and then he takes the embryo filter into process. So at day 6, this is what we see. It's a morula with a zona pellucida. By day 7, it's got an average size of 400 microns. By day 8, it's 800 microns. So these are much more easy to see in your Petri dish. And people such as my colleague in Argentina who do many, many flushes a day, flush on day 8 simply because then they can just look at the Petri dish and see it with the naked eye most of the time, and they don't have to spend time looking for them. So 400 microns diameter on day 7, 800 on day 8. Interestingly, this embryo obviously lost its zona pellucida, but they don't hatch. Instead, as the blastocyst expands, the zona pellucida thins and just flakes off the outside of the embryo. But the embryo continues to be surrounded by this capsule, which is a glycoprotein envelope that prevents the embryo from attaching to the uterus. So it continues to move around in the uterus until about day 14, the day of maternal recognition. So this is what we'd see if we flushed an embryo on day 7. It's a beautiful expanded blastocyst. As I said, a lot of people will flush on day 8. The pregnancy rate is the same whether you do transfers on day 7 or transfers of day 8 embryos, and the day 8 embryos are just a lot easier to find. When we talk about our recipient mares, the recipient, luckily, this is, every now and then we get an advantage in horses, and this is one of them. The recipient can have a very wide window of synchrony, 5 days, in which the recipient could ovulate in relation to donor ovulation. So she could ovulate a day before, the day of, or up to 3 days after donor ovulation. And research-wise, anyway, nobody's shown that there's any difference in pregnancy rate among those mares. Typically, practitioners will try to have the recipients ovulate 2 days after the donor mare ovulated. If we're doing, looking at results, if we're doing normal mares, we could expect to get the embryo from her uterus 75% of the time. You typically would get a 75% pregnancy rate after transcervical embryo transfer. So that translates into a 50% pregnancy rate per donor mare per cycle. Now, there are practitioners who have said that they get much higher rates than this, and I believe them, but what I know is until you've really analyzed your data and put it out there, the rate you think you're getting might not actually be the rate that the numbers say you're getting. One of the interesting things in mares, I think, also is mares are seasonal. So the donor mare is the big, expensive mare. She's in a stall, she's under lights, she's getting grain. And the recipient mares are the ones out there in the field getting nothing. Many times the donor mare will be cycling earlier in the year or later in the year, and the recipients are not cyclic at that time. And so we can actually use hormonal treatment of recipient mares, and again, this is very robust. If we've got a mare that is anestrus, we actually don't even have to give her estrogen. We can just start her on progesterone 2 days after the donor ovulates, and she'll serve as a very good recipient for that donor mare. We can even use ovariectomized recipient mares, and for people who have very small numbers, that actually is easier. If you ovariectomize your mare, you don't have to do a thing with her until your donor has ovulated. Then you can put the ovariectomized mare on progesterone. This is something that I think could apply to exotic species too. I've always wondered why people working in the dog haven't thought about trying ovariectomized recipients, because in that case you wouldn't have to worry about getting a bitch at exactly the same cycle, stage of the cycle as your donor animal. There's another great advantage to horses is that you can see the embryonic vesicle in the uterus by transrectal ultrasound as early as 11 days. The embryo is 11 days, which is like 5 days after transferring a 7-day embryo. This is a day 13 vesicle. You can see how big it is here. One time somebody asked me, what is the most wonderful thing about doing reproduction in the horse? Is it when that foal is born? And I thought about it and I said, it's not. It's when you do the ultrasound examination and there's that bright black circle in the uterus saying the animal's pregnant. So let's go on and talk about production of embryos from isolated oocytes, which is a little higher level of assisted reproduction. First, we have to get the oocytes, and we can get oocytes from live mares. We have a choice of getting immature oocytes from all the small follicles on the ovary, or, we'd have to do trans-vaginal ultrasound-guided aspiration, similar to what's done in cattle to get oocytes. When we do this, we have to work a little harder at it because the horse oocyte appears to be very closely attached to the follicle wall. In fact, this really only started being done by numbers of people in the last 10 years or so, because early reports reported very low recovery rates and a low number of follicles, so that they only got 1 or 2 oocytes per aspiration session, which made it pretty much not worth it. When we started trying to do oocyte aspiration and also got that same result back when I was at Tufts University in the 1980s. So one of my summer students decided to look at how the oocyte was attached to the follicle wall in horse follicles and in bovine follicles. So we took ovaries, we dissected the intact follicle out so that all the connective tissue was off the outside, and then you could see where the oocyte was through the follicle wall. We marked that with India ink and then cut it in so we could see the oocyte in its cumulus hillock in situ on the follicle. So here's a follicle, it would be like this. This is a bovine oocyte in its cumulus, and you can see that it's got little fenestrations here. There's a lot of tissue between it and the follicle wall. It's got a little 45-degree angle there in order to get it out of there. And you can imagine that if you came in with a needle and just aspirated, that this would just break off right here, and you would get your oocyte. But what we found in the horse was very different. We have a very thick cumulus over the oocyte, thin amount of tissue under it, no fenestrations, no neck. And you can see that if you aspirated here, either nothing would happen or the cumulus breaks open and the oocyte comes out. And in fact, we saw this hillock, this thecal pad underneath the hillock. And if you look a little closer there, you can see that, in fact, the granulosa cells underneath this oocyte have sort of roots anchoring it down into the theca. So this oocyte really does not want to come out of that follicle. And so this was the challenge to try to get transvaginal aspiration to work, is to figure out a way to get this oocyte out of the follicle. And the way that we do it, it's based on what Cesare Galli in Italy worked out. You aspirate the fluid, and then while the follicle's empty, you turn the needle around in there to kind of knock granulosa off. You fill the follicle with fluid to suspend those cells, and you aspirate it, and then you do it again and again and again. And we do it 6 times in our research mares. We did it 8 times for a couple of years in our client mares. You know, 6 is good, 8 is better. But in fact, we saw that there was no increase in oocyte recovery, so we do it 6 times. But what that means is that TVA in the mare takes a long time. It's a long process. These follicles are big, and it takes a long time to fill them and to empty them and to scrape them. And so it takes 45 minutes or so to perform a TVA typically on a mare. But if we do all that, then the recovery rate can be up to 50%. And we've gone to smaller and smaller and smaller follicles. So our average follicle number is about 12 now in the quarter horses that we work with. Cesare works with warm blood horses that tend to have a lot more follicles, and so he gets a higher oocyte recovery. He tells me that his recovery rate is now almost 65%, so we still have something to strive for. That would be nice. But what we get is about 5 or 6 oocytes per session. And then when we mature these oocytes in vitro, we can get about 3 mature oocytes per aspiration session. Our numbers are a little higher than that in the last couple of years. The second way we can get oocytes from mares is using the dominant preovulatory follicle. So this is a preovulatory follicle in the mare, and you can see that the follicle basically has taken up the entire pole of the ovary. These get to 35, 40 millimeters of diameter. If you put a needle in them, you can get 50 milliliters of fluid out of them. So this is the follicle getting ready to ovulate. You can actually see it thinning out in the middle of the ovulation fossa. So we could go into this follicle and get the oocyte, except that the oocyte's really strongly attached to the follicle wall. So we have to go in after we have stimulated this follicle with HCG so that we know that the cumulus is expanding and the coming loose of the follicle wall, and so the oocyte will be readily aspirated. Interestingly, because this follicle is so big, we can do follicle aspiration of the dominant preovulatory follicle without even needing an ultrasound. And this is what I did before I started doing TVA, is that we can put a trocar cannula through the flank. With our hand per rectum, move the follicle so that it's against the cannula, put a needle through the cannula, and then aspirate the follicle contents. And if we do this 24 hours or more after HCG, the cumulus is so expanded that our recovery rate, we don't even have to flush the follicle. Our recovery rate is very high, about 80%. And this is a viable method for recovering oocytes from mares. Again, my same colleague in Argentina does this routinely for oocyte transfer for client mares. He recovers them through the flank. This is a picture of me doing a flank recovery. The great thing about this is you can see the equipment needed. You got the trocar cannula, a needle, a tube, and a person on the syringe. So this can be done in any veterinary practice. The oocyte, when we get it, here's the oocyte here, but you can see how expanded the cumulus is. This is in the bloody preovulatory fluid, and the cumulus is pushing the blood away so that we can see the transillumination. So if we do the aspiration of the dominant follicle after gonadotrophin stimulation, the recovery rate is very high. If we go in at 24 hours after HCG, we'll get an oocyte about metaphase 1, but we can just put it in an incubator and it will mature to metaphase 2. If we go in at 35 hours after HCG, we can get an oocyte at metaphase 2 that's ready to be fertilized at that point. So we can actually work with that oocyte right away. The great thing about this oocyte is this is the oocyte. This is the one that was going to ovulate and make that foal. It is the highest quality oocyte you can get your hands on. So it's a good oocyte to work with. Another way we can get oocytes from mares, of course, is post-mortem. This is how my laboratory worked until all the horse slaughterhouses in the United States closed in 2007. So just going to the slaughterhouse, getting ovaries, as many of you probably did when you were learning in cattle. We still do work with ovaries post-mortem, but in this case it's clinic cases. So we get something around 20 cases a year where people call us, their mare just died or is going to have to be put down. Is there any way that we can get a foal from her? And we can. We can process the ovaries post-mortem. Again, because that oocyte is stuck to the follicle wall, you can't just aspirate the follicles. We actually scrape the entire granulosa cell layer from each follicle, put each follicle's granulosa into a separate petri dish and search the petri dishes for the oocytes. So this is laborious, but if that mare died and this is her last chance to produce a foal, the labor is worth it. We can get probably 80% recovery rate if we're working efficiently on this. So we take the granulosa, we just wash it into a petri dish. In this case, we're using M199 with Hank salts. When we started working with horse oocytes, we realized that we have expanded cumulus and compact cumulus in these little follicles that were nowhere near ovulating. And if you're a bovine person, you go, okay, you throw that one away because that's from an atretic follicle, and you keep this one because that one's got a nice compact cumulus. And it took me a little while. Neil First was on my PhD committee, so I went to his lab for a week, and that was my total instruction in oocytes before I started trying to work with horse oocytes, and I threw these away for a long time until I just needed something to test my Herx staining on. So I put them into maturation culture, stained them with Herx, and found out that they matured at a much higher rate than did these. Turns out these are from atretic follicles, but in the horse, atresia conveys meiotic competence before the oocyte's follicle so atretic that the oocyte dies. Whereas this is from a viable follicle, but in the horse, it's not going to become meiotically competent until that follicle is over 20 millimeters in size, and only about 5% of the follicles we find are over 20 millimeters in size when we're processing ovaries. So if you're ever thinking of working with horse oocytes, the bottom line is keep all oocytes. Don't throw anything away. Just put them all into maturation, and they can tell you whether they can mature. So when we got to being able to separate these very well, what we find, and this is very repeatable, oocytes with expanded cumulus give us about 65% maturation. And if you're stringent about what you call compact cumulus, no expansion whatsoever, these give you about 20% maturation in vitro. One of the things that allows us to do the work that we do, we found that 30 hours maturation works for both oocytes with expanded cumulus and oocytes with compact cumulus. The ones with compact cumulus take a little longer to reach optimum quality in vitro, 30 to 36 hours, and the expanded 24 to 36 to 30 hours. So 30 hours is a good medium. But if you're aspirating, doing TVAs on mares, or even going to the slaughterhouse when we had one and coming back, you don't have your oocytes till the middle of the afternoon. A 30-hour maturation means you'll be doing your manipulations with them in the evening or night of the next day. So we worked on ways to hold oocytes, stop them from maturing so that we could put them into maturation first thing in the morning. That allows us to work with them the afternoon of the next day. And what we found was we could actually just put these immature oocytes in medium 199 with some serum, hold them at room temperature, and there was no effect on maturation rate. In this study we did in 2006, the maturation rate if they were held overnight was 65%, and if they were matured immediately, 68%. And no effect on blastocyst rate. If they were held, we got a 34% blastocyst rate. The control in that study was 25%. And this has been repeatable enough that I think it might actually improve my developmental competence. So once we have our mature oocyte, what are we going to do? Everybody immediately wanted to do in vitro fertilization. That would be about 1970s, and here it is 2016, and in vitro fertilization still does not work in the horse. The low fertilization rates, not repeatable. There are sporadic reports of success up to about 30%, but even those laboratories have not been able to repeat their success. The major barrier is that the sperm don't get through the zona pellucida, and we've done, as you can imagine, many research projects trying to figure out why this is, and currently at this point in time, nobody knows. That's a big X right there. There was a paper in 2009 that got everybody very excited. McPartland and co-workers at Cornell said if they treated with procaine to stimulate hyperactivated motility, then they got fertilization. We could never repeat. I'm a co-author on that paper because I supplied the oocytes. We could never repeat that in our laboratory. And then Bart Leemans in Ghent found that procaine causes fragmentation that looks like cleavage, and that could be what was happening in this study. Nobody's been able to repeat that. So what do you do? Well, the first thing that people did was oocyte transfer. So here's a commercially viable technique that has not been developed in other species because it didn't have to be. If in vitro, if you know how to get an oocyte and you get a mature oocyte, but you can't fertilize it in vitro, what do? And this is, well, you put it into the oviduct of a mare that can, say, carry a foal to term, and you inseminate that mare. So it's a very simple concept. It's effective. It's the most effective. You've got one in vivo matured oocyte. This is the most effective way to get a foal from that oocyte. It's conducted on a commercial basis. CSU doesn't do this anymore. Colorado State is not doing oocyte transfer anymore. They've moved to ICSI. But in those places where there is no ICSI available, such as at my colleagues in Argentina, they do oocyte transfer commercially. because it doesn't require a micromanipulator, it doesn't require extensive laboratory materials. You can do this in pretty much any veterinary practice, well-equipped reproduction practice. The basic technique is you synchronize follicle growth in your donor mare and a recipient mare. And in this case, we don't know, nobody's done the research, but we synchronize them to the day. Recover the mature oocyte from the donor, and then we also have to recover the mature oocyte from the recipient and throw it away so that she doesn't conceive with her own oocyte. Then we transfer the donor oocyte to the recipient oviduct, and we inseminate the recipient. The transfer is done standing flank laparotomy, and luckily for us, the oviduct is attached to the ovary, so we just have to reach in, pull the ovary out, there's the oviduct, and we load the oocyte up, cannulate the oviduct, and put it in and close the animal up. So the results are great if you have a pre-ovulatory oocyte. So this is a high-quality oocyte. It's about 70%, 80% if you're good, oocyte recovery, and about 50% pregnancy rate after transfer, and this varies depending upon how infertile the mare is and how old the mare is. But it's a 35% success rate per cycle, and this is on old mares that have not been able to get you an embryo. So this is a lot better than nothing. So this was used for many years by CSU, and they had hundreds and hundreds of foals using this method. The drawback, of course, is the surgery. In order to get this to happen, you have to do surgery. It's not appropriate to use when you have lots of oocytes. It's good for one pre-ovulatory oocyte, and you put it in the right place. But if you want quantity, this is not the way to do it, because you can't put bunches of oocytes into one oviduct. Well, I guess you could if you wanted to flush the mare out again and retransfer them, but you've got losses all the way along. So what we did instead, one of the reasons we started, when I got to Texas A&M, I had done oocyte transfers at Tufts. When I got to Texas A&M, we started doing oocyte transfers there. But the surgery itself was a huge deal. We had a small herd of mares. They allowed us to do surgery one time on each mare, and if you've only got a 35% pregnancy rate, that means 65% of the time you did the surgery on the mare, you didn't produce a pregnancy, and now you can't use that recipient mare again. So there just had to be a better alternative. And intracytoplasmic sperm injection turns out to be a better alternative. And as probably everyone knows, this just means that you pick the sperm up in a pipette and you inject it into the cytoplasm of a mature egg. This is work done in my lab, is all done by Dr. Young-Ho Choi. He started with me in the year 2000 and helped develop the whole technique in the laboratory. When we first did it, we saw this was an amazing sight for us. This is a horse oocyte with 2 pronuclei and 2 polar bodies. And we were able to culture them up to about 4 days in vitro, but getting blastocysts was very, very difficult. And other laboratories around the world had also had that same problem. And what we found was, kind of by accident, that if we used a complete cell culture medium, this is a medium that should not be good for embryos, that we could get the embryos to grow to blastocyst. And this is an in vitro produced equine blastocyst. This is what they look like. And from the time we found that in about 2004, we've progressed to being able to use this whole technique both for research and commercially with pretty high efficiency. So embryo culture in vitro, we use DMEM F12. Right now we're using a embryo culture media for the first 5 days and then into DMEM F12 with 10% serum. We use it in mixed gas with 5% oxygen tension. And typically we get 20 to 35% blastocysts with our research animals. Luckily, you probably all zeroed in on that serum in there in the DMEM F12, but the foals produced using this culture method with embryos cultured in this medium have all appeared to be normal. We haven't had any reports of anything looking like large offspring syndrome or any syndromes of any kind. We haven't ever done a study of these embryos, the ones that make pregnancies, because it's so expensive to keep a horse pregnancy to term. We haven't done much research on it. They're all been sent out to clients, but we have not had any reports, any detrimental effects. So we moved on from doing the research on ICSI to doing ICSI in client mares. And why would people want to do ICSI? I thought the big thing would be that mares are unable to produce embryos, but in fact the big push is stallions. That there's a stallion that is at the top of his field, his stud fee could be $20,000, and he's so old that he can't breed mares and get them pregnant anymore. Frozen semen really doesn't work very well in horses. It works, but you have to use like 5 straws, and you get a 35 or 40% pregnancy rate, and so your store of straws is used up very quickly. Well, with ICSI, since theoretically we use 1 sperm per oocyte, we could take a straw of semen, thaw it, dilute it, make 200 straws, and use part of one of those for an ICSI procedure. So a store of frozen semen will last a long time. And the stallion owners have recognized this and recognized that they can tell the mares they're going to have to do ICSI to breed to their stallion, and they can still get their $20,000, and the mare owner will do it because their stallion is that good. Few labs do this right now. More labs are becoming more interested in it as they see that it will work, but it seems to be a difficult thing to do. You know, we've worked on this now for 16 years, and we have a repeatable method. Dr. Cesare Galli in Italy, Rob Foss in Missouri, Elaine Carnevale in Colorado. Actually, only 2 people have ever published clinical results with equine ICSI, and that's ourselves and Cesare Galli. So many laboratories are starting up, and we'll see what their data is when they publish it. This is what our ICSI program looked like in 2009. This was all mares that had their TVAs done, the trans-vaginal aspiration done at TAMUs. So we had about 5 mares. We did, well, 10 mares. We did 20 aspirations, and we got, I think, 3 embryos from our client mares. So this was a lot worse than what we'd gotten on our research mares, and we changed a few things. But you can see that over time, it's become overwhelming, actually. Our lab had to stop here and say, you know what, we can't handle any more than this. We're going to have to keep it here. But these other colors, so this is mares, aspirations, and embryos of mares that have the TVA done at Texas A&M. We had a referring veterinarian that aspirated the pre-ovulatory follicle, and so sent us 1 oocyte at a time, and then did more the next year and even more the next year. But we actually in here very, very rigorously trained veterinarians to do TVA of immature oocytes so that we wouldn't be the only people around doing them. And they started sending us immature oocytes here in 2014. So these are, again, mares, aspirations, number of aspirations, and number of embryos that we shipped. And you can see that for these, that there's more than 1 embryo produced per aspiration, and that's continued. You can see that the number of mares in blue here that we're aspirating at Texas A&M has gone down, and the number of mares that have immature oocytes aspirated by referring veterinarians is going up. And this year we did, you know, the difference between this and this is embryos per aspiration, and this year we did very well. We got over 300 embryos from 202 client aspirations shipped to us. So aspiration being all the oocytes aspirated on a single day. We can do ICSI post-mortem, as I said. Here's a mare that was dying in our hospital. People also ship the ovaries to us from around the United States. What we hope to do is process the ovaries and then end up, this is a foal that was actually produced from that mare by post-mortem ICSI. And in reviewing that from 2006 to 2009, what we found is with 16 mares, at the end, we produced 10 foals. But it's not like really 10 out of 16. the foals were all produced from 6 of those mares. So the mare's oocytes either produced foals or didn't produce foals. And you can imagine the cause of death and the amount of time the mare was sick before she died would have a big effect on that. And here are 2 foals whose both their mother and their father was dead at the time they were conceived, because they were conceived from frozen semen from a stallion that was already dead. I'm just going to go over at the end here cryopreservation, because we've worked on this a little bit. And when you saw that big blastocyst, you might have thought, well, that would be a challenge. It's a challenge in many ways. If we just use a day 6 embryo, it freezes by slow freezing or by vitrification, just as well as a bovine embryo does. But if we look at this day 7, which is what the practitioners want to collect because they get a better recovery rate, it's easier to do, this does not vitrify or freeze very well at all. So by not very well at all, very low pregnancy rates after vitrification or slow freezing of these embryos. What we found, we were looking at embryos wanting to biopsy them for genetic analysis, and we found that when we biopsied them, they collapsed. So this is a collapsed embryo after biopsy. But we found that when we cultured it, within a couple of hours, it would re-expand. And when we transferred them, they made pregnancies with no decrease in pregnancy rate. So we thought, well, maybe we could collapse the blastocyst and then vitrify it, and that would allow it to be vitrified. So we actually did that. Here's a blastocyst before biopsy and after biopsy, and then vitrified and warmed, and then cultured for 24 hours afterwards. And you can see it's actually increased in size from its original size. And so using media, we used a couple different media, so this didn't work with everything, but with this media, we got a 71% pregnancy rate, 5 out of 7, all with heartbeats. And so this is a very small number. We also do this now clinically, and our foaling rate from these embryos is about 50%. This has been repeated by Diaz et al. of Louisiana State. They used what they call an embryo cradle to deflate the embryos, and then vitrified them using a commercial equine vitrification kit on cryotops, and also got very good pregnancy rates. So here we have a method for freezing embryos in horses. Why would we want to do this if we're only getting 1 embryo at a time? Well, it's a man-made problem. Most competitions have January 1st as the birthday for all the horses competing there. So if you're a 2-year-old and you're competing in halter, if you're born in June, you're competing against a foal that was born in January, you're not going to do very well. So the owners want the foals born as early in the year as possible, so they'll have the chance to grow and be the biggest in their group. But the gestation length's 11 months, and the natural breeding season doesn't start until April and peaks in July. So you can convince a mare to breed in February so she can have a foal in January, but they would much rather breed in the middle of the season. And old mares will pretty much only breed in the middle of the season, and so their foals are born too late. So with embryo freezing, you can breed that mare when she's actually fertile, and then freeze the embryo, transfer it to recipient the next February, and have a January foal. So now we have a way to freeze blastocysts, keep them in liquid nitrogen, and then use them when we need to, which is really going to be a great boon. This is only in the last couple of years this was developed. So that's it. I'd like to acknowledge the funding for the work that was done in my lab, the Link Equine Research Endowment, and the American Quarter Horse Association that funded the cryopreservation, and a private individual, and the people in my laboratory that helped with all this work. Thank you.